first of all, the role of diplomacy, the role of development, and the role of defense. And these are three major thrusts, pillars, ways in which we approach and are involved with our foreign policy. So how is that actually operationalized? So if you decide you want to be a diplomat, where do you work? I mean, you could become a state Department of State fellow. It's a great career. But where do you work? You work at an embassy doing initially visas, helping people get visas or not get visas, but you know, those long lines. And then you might move up to be a political officer, a communications officer, and then you might end up running the embassy. It's an exciting career. Then also we have the Department of Defense in terms of our defense, and we send out soldiers in the military to do something in the name of conflict or helping or misguided things. Sometimes the diplomats and their great knowledge is not always heard by the people over in the Department of Defense, which is unfortunate because they have lots of ideas in the Department of State, but there's a gap there. Now, if you wanted to get into development work, what is that? That is within the Department of State, you have a separate entity. It's fairly separate, and that's the United States Agency for International Development. And people, I know when I was your age, I didn't know anything about how to work overseas. I was just fortunate enough to get into the Peace Corps because it was formed in my senior year of college. But most of you, I know from my course in global development, have had some experience through mission trips and through working with NGOs or having your parents work for NGOs. So this is to sort of stretch your understanding that there are other ways of working in development than just the NGOs. And it's interesting to compare and contrast what does the Agency for International Development do and what do the NGOs do. And then of course we've got foundations. And it's amazing what the Gates Foundation has done. It's just, I can't say enough about it. And their work and what the amount of money and effort they've done has really changed the way the world, certainly in the areas of HIV and AIDS and TB. It's really been tremendous. So if we look at how much are we actually spending on this, so this, in the terms of through the State Department, through the Department of Defense, it's your tax dollars, if you're yet paying, but you will someday. It goes through Congress and then it gets allocated. So you look at the differences of the amount of money that is spent. So in defense, we had 18% of the federal budget, $700 billion was spent in 2018, and then it increased a little bit to $716 billion. 18% of the budget. So what is it, how much are we spending in terms of foreign assistance through the diplomacy, the dialogues that they have in terms of the ambassadors with other countries? It's less than 1% of the federal budget of foreign assistance, 41 million. Then in this year went down to $27 billion. How much is spent on development where you would say this is the actual interventions that are going to make a difference in people's health status? We are at 22 billion in 2016 and 17, and then 2018 was 15.4 billion. And it gets smaller as you read in the paper if you're following that in terms of how much it's getting cut.
Now, as I said, we were invited by the Gaza Community Mental Health Program, which does an amazing amount of training and service. This is Dr. Yassa Abu Jamai, who's the executive director. And he told us in 2015, I feel crazy, but I come to work every day. We have 1.9 million crazy people here. And what we found is that every clinician that we spoke with at that point had to talk about the war and what happened during the war. So there was 51 days of fear, bombing, death, trying to mobilize the staff. There was a huge amount of trauma in the environment, politically, human catastrophes. And he said that in Gaza, there's no such thing as post-traumatic stress disorder. There's only continuous stress disorder. And what he sees in 2017 is if there's someone who was severely sick psychologically and they get a little better, then there's an incursion, a bomb, a loud noise, and they immediately relapse into their old stress disorder. He himself lost 28 family members So an example of how the staff is as traumatized as the patients. And he said, I cannot offer patients something I cannot have for myself. This is Hussam El-Nounou, who's the administrative director, and he talked about the link between mental health and human rights, that this center uses what's called the biopsychosocial model, mental health in its broadest sense, and that the frustration, the hopelessness, all of this is a recipe for violence, violence against oneself. There are rising suicide rates against family, children, women, communal, tribal. He described Gaza as a time bomb. And he sees the work of the center is to diffuse the anger and then work to open the borders, open the economy. And he had a little son who a couple of years earlier had told his father, I want to be a martyr, which completely freaked his father out. So he probed further and further, and the little boy said, well, if I'm going to die anyway, I want to die for something. The center also has community centers. This is an example of a program in Deir al-Balah. This is Dr. Amal Bashar, who's the only female psychiatrist in Gaza. And she did an amazing art therapy project for kids with PTSD that's never P. And I just want you to look at the kind of pictures that these kids are drawing. You know, kids flying kites being bombed, lots of death, people lying on the ground. One kid wrote on his picture, so if you killed my child, you think you are strong? And this little boy's father was killed driving his vegetable truck. And for these kids, the Star of David is a symbol of death and destruction. So these are just kids' drawings. This is what they see in their lives. It really gives you a sense of the level of trauma. One kid wrote, I want to live in peace. And when we were back in 2017, I was struck by the fact that the child therapy area where all these toys are had all different kinds of weapons, because the kids have to work through all of their experiences with weapons, and that their art still was pretty disturbed and with a lot of destruction. So as we look forward to this wonderful year that we're facing, we have the same health crises that I've mentioned, only everything is a bit worse. There's lack of chemotherapy, radioisotopes, there are severe shortages in essential medications. There's a big problem where patients can't get permits, medical permits, to get treatment in Israel or in East Jerusalem. There are rising cancer rates because of the toxicity of the environment. There are the ongoing electricity shortages, fuel shortages, and you've got to think about the medical personnel. They are exhausted, and they also often are working without pay or with only partial pay, and they're working with an enormously and chronically traumatized population. The other things we see in Gaza are rising malnutrition, unemployment, poverty. Another medical issue is there's a rising antibiotic resistance, partly because there's not good labs to test things, and there's not good people washing their hands, basic stuff. The surgeons are also overwhelmed with injuries, and there's a lack of rehabilitation services. We see rising infant mortality and maternal mortality. Again, the civilians are paying with their lives.